Hi, welcome to the Spawdcast. I'm here with my co-host, Brittney Whiteford.
Hello, everybody.
And in the studio today, we have Dr. Jean Dodds, who's a world-renowned veterinarian. Hi, and welcome, Dr. Jean Dodds.
Thank you, my dear.
She drove all the way down here from Santa Monica, and
Yes.
we appreciate it. And then she has to drive over after this podcast to talk to, you're going to be meeting some clients today at work as well, right?
At Hemopet, yes.
Yeah. Most of you guys, our listeners, know that we do everything in studio, so it's a big feat to get people in here, and we cannot tell you how much we appreciate it. So before we get started, or one of the things I want our listeners to know is what you guys are going to be listening to. We're going to be talking mostly about vaccines, titers, and hopefully we'll have time to get into some flea preventatives. But there's a lot to go over with vaccines. There's so much confusion, right, Brittney?
Yes.
I mean, our clients are so confused as to what is going on. And do I, don't I, should I, shouldn't I, when shouldn't I, do they shed, do they not shed?
Right.
So we're going to go over all of that. But before we do, Dr. Dodds, can you tell us a little bit about why, kind of want to get a little, like, what made you want to be a veterinarian?
Well, one of the things was my family are all in the medical field, and they're in human health field. And I decided when I was very young that I loved animals. And my late father used to say it was your Aunt Dorothy who was a naturalist. They had monkeys as pets, and they loved animals. And she twisted you so that you became an animal person. And he said, you can't go to veterinary school. All they learn there is bunches of things because they couldn't possibly learn the details of every different species like we do when we do anatomy or whatever. So after my first year at veterinary school, he questioned me, and he pointed to his arm, and he said, what are the nerves and the whatever, and I told him. He said, oh, my God, you really do learn it all.
Wow.
I guess I should just be quiet and let you be a veterinarian.
That was your first year?
Yeah, my first year of veterinary school.
That's amazing.
1959.
Oh, wow.
Been a veterinarian for a very, very long time.
That's amazing because it takes you on such a journey, right, of change and discovery and all of the things.
And women were not welcome at the time.
Oh, my goodness.
Yeah, that's
wow.
amazing.
That's changed, of course.
Yeah.
It's definitely
It never bothered me. I didn't worry about it. I was going to be a veterinarian, and God would let me be a veterinarian, and I didn't care.
Well, you've kept with that tenacity, and now you're just coming out and speaking out. What vet school did you go to?
Ontario Veterinary College.
And
It was the University of Toronto then. It then became UG, the University of Guelph. But my degree is from the University of Toronto.
oh, wow. And how? So then you're now in Southern California.
Right.
And the name of your practice is Hemopet, correct?
Hemopet, right.
Right.
And we have a holistic subunit of Hemopet called Hemopet Holistic Care.
Oh,
and we have
amazing.
2.5 full-time holistic veterinarians working with me there. And we're just growing incredibly well.
That's amazing.
Yeah.
We really don't. We're in Southern California as well. This is where our studio is. And Brittney and I can tell you, we struggle very hard to find holistic veterinarians. So, but with that, we actually have a lot of vets that call themselves holistic. And actually, we don't think they fall in that category per se, but Dr. Dodds definitely does. So it's exciting.
Yeah, and
to
my
have
colleagues do. They're all certified. 2 of them just were certified in chiropractic in Wisconsin with Dr. Rivera. So we do all the modalities there now. The only thing we don't do yet is ozone therapy, which we hope to introduce.
Yeah,
Oh,
ozone's
that's so
that is going to be really amazing. 'Cause
We are, and high dose vitamin C. We're doing that, and we also do digitherm, which is digital thermal imaging.
Oh, wow.
You should read about it. It's amazing.
You know we're going to, and then we'll have to have you come back, and we'll have to do a whole episode on that.
Okay.
So one of the things I want to tell you before we dive into vaccines is this is not, and you will not know this, or even try to remember, but this is not the first time I've interviewed you. So I interviewed you on the phone about 14 years ago.
Wow.
I know. And I was so excited because you answered the phone. I called your office and you answered, and I was completely thrown away because I said, hi, can I speak with Dr. Jean Dodds? And you said, this is she. And I said, really? And then I didn't know what questions to ask you. But what I was doing is I was on the speech and debate team in college, and I was working on a speech that I wrote about the need for dog blood donations. And so I was working diligently trying to figure out how I was going to turn, when I was competing in college, most of the debates and the speeches that I was going up against were about AIDS, cancer, and here I'm standing up saying, our dogs need blood. And it just was very difficult. And so I called you, and you were so nice to me and explained to me the differences between greyhounds and why you were using greyhounds. And I just want to let you know that that speech fought really hard in the beginning, but it actually won a top national competitive award on persuasion.
Bravo.
Yeah.
Bravo.
Yeah. And it had a lot to do with my interview with you. And so you can actually look it up. So it's an interesting little speech, and it was amazing. And we talked about a dog named, I remember his name was Officer Kim, and he was stabbed, and he actually needed dog blood. And so it was kind of an interesting topic. So this is my first interview with you.
That is so cool.
However, it is the first time that I've actually sat in a room with you and met you. So I'm a little excited. And Brittney and I are very excited to talk about the vaccine issue that is going on. So before we get too far into it, can we just talk a little bit about what parvo is, what distemper is?